Bienvenidos a Conversando con Luisa. Aquí nos reunimos semana a semana para sumergirnos en fascinantes diálogos y descubrimientos. Prepárense para explorar juntos un mundo de ideas intrigantes.
I'm a medical doctor. I'm a community worker. As Luisa knows, I participate in different activities around to help the community. But I've done medicine, finished 1991, then went to USA, did some training, then came to Sydney, and I became a specialist in the area of basically diagnosing cancers, working up patients with cancers. So there's lots of treatment options nowadays available for cancer. So my work is that. Other interests are I like playing some sports, participating in community activities, trying to promote holistic health. A fair bit of to join you. I'm very pleased to be speaking to your audience. Thank you for inviting me and letting me communicate with your followers and people of your community. It's such a nice thing to be in a country like
this. I really appreciate it because the topic is very sensitive, and sometimes we want to avoid the topic because it hurts a lot, especially when family members or love, friends are affected by it. So, as I said, cancer is a topic that maybe years ago people didn't like to talk about it.
Making sure you have some fresh food, usually better made at home, not every day outside, because they are what's called refined oil, heated foods, eating outside all the time, and especially something like a fast food chain, KFC, McDonald's, Hungry Jacks, all these things. They're there to make profit. Please understand that. They're not really feeding you. It's a business. So these are the tough things. But as a medical professional and a person who wants to help community understand this thing, I just put it out there. I know it's very hard for people sometimes to even listen to these things that I'm saying. So there are things that we can definitely do. Stress is what our body goes into, which is called fight, fright, or flight, kind of survival level where hormones in your body gets disrupted. So other factors that are described plus the stress, they combine to disrupt our genes, and depending on where and which organ you are affected, that's where the cancer starts growing. Because as it is males, we traditionally, ancestrally, old times, man was the hunter, was in the jungle. It had to go get the food and can't complain about life, basically look after your family. So we are inbuilt in our brain as men, not supposed to complain, not supposed to talk about being weak. Okay, so it is within us. That's why men behave like that. So understanding that part, but then realizing that times have changed. We aren't living in jungle. Everything is well and good now, and there are systems in place. So a man should be slowly learning how to talk about different issues, not only health and everything else, at a social level, at a family level too. So prostate cancer is very similar to breast cancers. So we talk a lot about breast cancers, and there's lots of good things that are being done to prevent breast cancer, treat breast cancer, and there are a lot of treatment options. At the moment, every modern city in the world, there is a risk of 1 in 2 person getting cancer. It's a very high risk now. 1 in 7 women get breast cancers. 1 in 9 men get prostate cancers. So the risk in itself is very high, but I don't want to scare you. The thing is, treatment options are very good now. We have advanced a lot in all different types of cancers. Treatment options are available. So while in a female, it's a hormone-related organ in a breast. So I talked about alcohol. I talked about, meat. I didn't mention that before, but animal-derived protein, meat-based, especially red meat, they are hormones which stimulate uh, the cells, the milk-producing cells in the breast. So that's why you have to be careful of balancing basically, or trying to minimize as much as you can animal derived fat, animal derived protein as well. If you have to go into taking meat, it's better to take white meat, be it fish or chicken or something like that. But red meat definitely has been shown to be a negative component, like alcohol, like smoking. So again, a tough thing to say, but just keep in mind these are hormone boosted, either breast or prostate. They respond to abnormal increased growth, which is cancer, due to your body being exposed to different types of hormones, and fat and meat definitely have that gives you increased exposure. So prostate cancer, this it's not very difficult actually for a man to get tested, because if for some reason as you grow older, 40 years, 50 years, and you have now increased number of times you have to go to the toilet in the night, say for example, or you can't control your urination, or if there's blood in the urine, you don't want to share with anyone, just go to a GP. Your GP will do a blood test, and blood test is called PSA, prostate specific antigen. It's quite a simple test, just a blood test. It will take, at least you'll get some indication of if there's anything to do with your prostate cancer, because most of the prostate cancers will have very high value of your PSA. So you can, if you it's probably harder for women, because mammogram, women know when they have a mammogram done, it's not an easy procedure, and we don't have blood tests for screening breast cancer. But for prostate cancer, definitely there is a blood test that can be done, urine test will be done. And don't feel shy. Usually the doctor examines your prostate by doing the finger test. So let it be, because it can be examined and felt similar to how a woman needs to be able to check any change in texture, size, anything goes in the breast. You need to look at it when in the shower. Men, if there's anything, please go to a doctor, get a blood test done. If there's something there, then you'll get an MRI done or CT scan done. And because just understand the best options at the moment we have. We can talk about all the prevention, how our grandparents and parents lived in the lifestyle they had. They had not all this kind of technology and benefits, but their lifestyle was simpler. They were able, they didn't get all those kind of diseases. There was definitely, there was not happening as common as now. But for the moment, we can't change, as Luisa said. We can't change. We are in a stressful community, society. The few things that I mentioned include in your family and your children. But what can we do in reality, in actual fact, is get yourself checked. Because if you get checked, and if we as doctors are able to pick a cancer early, and early means that you some many times you can't feel it with your hand, or you can't touch, you might not have any much signs. Say for example, breast cancer, there's no sign or symptom, there's no even lump when it's that early. It's only the mammogram uh, machine, the x-ray of the breast can pick it. So similarly, as you grow older, for men, if you're 45 and above, make it as a routine. If you get cholesterol checking, your blood cholesterol check, just ask your GP to do a PSA test for you and say, can you examine my prostate gland? Just have a, like, at least a baseline, because when a cancer doesn't form a big lump, less than 10 millimeter, uh, it's very hard to have any signs or symptoms in your body. It's not, doesn't do anything. But if it becomes 2 centimeter, there's about 100 million cells there, and it's more likely to spread. So picking early is one of the most important things that can help a person. If, and it can be any organ, any place in your body, because surgery can be done, and the other types of treatment we'll talk later.
And they just keep
Yeah.
quiet. They never ask for anything.
Hmm.
If they have a problem, they just want to go to the doctor, get it fixed, and go home.
Yeah.
So what's your advice?
Yes. So the thing is, leaving a disease is only going to make worse in whatever complications you are worried about, either from chemotherapy or surgery or anything. The cancer itself will make you really can't have proper urine, you'll have blood, you'll start having back pain, it might spread to your bones, your sexual functions will go in itself. So if you are afraid of the complications that are arising, it's less likely it will be as bad as if you don't want to do anything about it. So it is easy, it is in the interest of the patient that they get picked early. And the good news, as opposed to the breast cancers, even in young women, can be very quite aggressive most of the time. In prostate cancer, most of the time it's not very aggressive. So that's a good thing for men to know, that they don't. When we assess a prostate cancer, we grade them. So grading usually is the criteria which is utilized by the surgeon to see if they want to cut it out. And these days, even having a surgery is not as harmful to your body as before, because before men used to become impotent and things because nerves used to get cut. Now there's robotic surgery. There are very fine methods of doing surgery where you can prevent nerve damage, sexual function, and other things will be preserved in case you get a higher grade of a type of cancer. So not it doesn't mean that, uh, and it applies to all the cancers. Cancers are not one specific type in an organ. Say breast has about 15 different types of cancers, prostate has about 10 different types of cancers. Each of them have different types of grade, and grade means how aggressive it can be. So so a little bit of knowledge, and having this knowledge will help you make a decision. So if it's a low grade prostate cancer, um, you really don't do too much. Actually, you can live within anywhere, but you'll have a follow up with the doctor, and they will keep assessing you. The high grade type, high risk type of which can spread, will obviously you can get a robotic surgery done, removed. In an older patient, obviously, the options are different. There are different types of hormone therapies which can actually um, reduce the cells, increasing in number. So that is the option also. In, say, we do it for breast cancers, we do it for prostate cancers as well. There are different types of anti hormone therapies as well. So options, there's lots of options, and at the moment there are many more new options as well. So we have new types of drugs which are called immune check blocker. So in cancers, what happens to immune systems? So when I was talking about why you should have good diet, bit of exercise, like 30 minutes of walk 3 times a week is very important. It not only keeps your weight in control, but it increases your immune function. So immune function is one of the issues that happens with any type of cancer. So that's why diet is so important, to have green vegetables, fruits, different colored foods, and fresh food, and because your immune system is what protects us from getting cancers. Otherwise, cells are getting cancers every day in everyone, but our what's called the army within our body, the immune cells, are protecting us. As you grow older, and especially if you're exposed to high stress, wrong diet, lack of exercise, and other things, your immune system then becomes not so strong. So now at the moment there are certain types of drug which actually helps the immune system get excited in the body, and they can target like a bullet to kill the cancer cells as well. So we have new types of treatment which is called personalized treatment. We do specific tests. So as I said, whilst a lot of cancer is happening, but there's a lot of advancement in terms of different types of modalities. Apart from chemotherapy, radiation, we have many other different medications which have less side effects to control these things. So sharing knowledge, being aware, is very important at this time, because diseases, yeah, they are happening and it's just everywhere. But there's lots of good news as well, which doesn't go, is there's lots of ways we can actually make your life better. You might have cancer, we might be able to catch early, or we can either control it or definitely prevent you from getting disability, complications, and you will help your life, live your life properly. So just sharing this knowledge is very important. Okay. So that's prostate cancer. So breast cancer, similarly for women, I keep putting it together so that you are aware. Yes, very very important. Actually, as I saying, when you are physically active, not only you reduce your weight, because obesity is directly related. Like in COVID, when we were COVID, people who really got severe COVID infections were people who were obese, like they were fat. So exercise not only helps you reduce your weight and makes you fit, but it stimulates your immune system. A lot of chemical mediators are produced in your body. Good chemical mediators in our brain called uh, um, um, endorphins, and there are lots of other chemical mediators that are produced by exercise. So simple formula is like 3 times a week, at least 30 minutes, please do some brisk walking, fast walking. That will stimulate your body, and it's a general thing. It will help your cardiac health, like heart, lung, brain function, like, prevent you from dementia, lots of other good functions, all other types of cancers. So diet, avoidance of alcohol, reducing as much as you can red meat, and adding nice different types of fruits, seasonal fruits, different colors, berries and other stuff, and trying to make food at home with exercise. Oh, you can actually reduce by 50% your chance of actually becoming really sick, even including cancers. These are scientifically shown that if you can reduce it dramatically by being conscious about how you are looking after what you're putting in your mouth, what are you doing in terms of exercise, and what are you doing to your mind. Because end of the day, if your mind is not relaxed, it also has an impact on your body system. Because um, if you are too by being conscious about how you are looking after what you're putting in your mouth, what are you doing in terms of exercise, and what are you doing to your mind. Because end of the day, if your mind is not relaxed, it also has an impact on your body system. Because um, if you are too much occupied in everything in your brain, in your mind, then it also has an impact. So that's where the stress comes, relaxation techniques comes. Walking is one form. Other things I personally do is breathing exercises, I do meditation, I do yoga. So there's no one simple solution for anything. There are different combinations.
Gracias amigos por unirte a Conversando con Luisa esta semana. Si disfrutaste de la conversación, no olvides suscribirte a mis redes sociales. Nos reencontramos la próxima semana. Hasta pronto.